Hi everyone, this is Mareva here. Welcome to Bodyworkers Mastercourse Part 40. Today we'll be focusing on the radial and dorsal forearm, and I'm here to introduce you to your class instructor.
Hi! Today we're going to be working on the forearm pain that's right here on the thumb side, and also so radial forearm and back of the forearm pain today, right here. So those two areas. So that's what we're going to be working on.
That's the focus, picking up on our tennis elbow focus of last week.
Yes.
Well, broader than tennis elbow, but
yeah, it's coming down this way from tennis.
Down.
Here's our tennis, and then coming down this way.
Still in the arm section.
Yes.
Okay, so before we get started with that, that I like to remind you might like to have. If you go to www.myopain.com, you can find the protocols we'll be using for this class, which are 52 and 54. You might like to use your pain charts, as you see behind me, if you have the trigger point pain patterns from Chevelle and Simons, or the books if you have them. And if you have the fin and shiflet range of motion testing charts, you might like those as well. Those are a few things I'd recommend getting handy, as well as any self-care tools like the ones you see over here, or any of the homemade ones that you've worked up. Get your measuring tapes or Queen's fingers ready. And then if you like to get some CEUs, 2 CEUs for this class, just watch the class, tune in, watch this live today, and then afterwards you can email us at info@myopain.com with your Periscope handle, the name of the class that you watched, your name and your license number, and we'll make sure that you get credit for that. And before we get started, there's still time for you to share this with your friends. You can hit the little ellipsis at the bottom of your screen and tell your friends on Facebook or Twitter or wherever, Periscope, invite them. Thanks, I see someone's already doing that. Thank you.
Great.
So yeah, Sharon, more about what we're going to be focusing on today.
So what we did was we worked with Dr. Simons on this, and we cordoned off the body into 60 sections. And the sections we're working on today are right here on the thumb side of the forearm and the back of the forearm. So the thumb side of the forearm, which is 52, and then the back of the forearm, which is 54. And these are the muscles that cause the pain in that side of the forearm and that part of the arm when it's referred pain. So this is and referred pain could be a goodly amount or most of the pain that people experience is chronic pain. So very much of the pain that we experience is referred pain. So this is very important to learn which muscles are actually causing it. And I think there's some very interesting things that you can see here. Here we're talking about the forearm, right? Right here. So we're talking about the forearm pain right here, here and here. But look it's a muscle in the shoulder blade that causes the pain here. It's the muscles in the neck that cause it. It's muscles in the arm, in the area that's hurting. So these two weren't, but this one is. This one here is way up in the shoulder, way up in the top of the shoulder blade, and here in the front of the chest. So here, all these muscles except for one is right where the pain is. So if you don't look in distant areas for taut bands that could be causing the pain, you may miss the pain, what's causing the pain completely.
You may.
Completely. Then for the back of the forearm, so this would be this one here, 52, is for this kind of on the outside, partly the forearm, and then here the back of the forearm. And this is caused by the triceps, so then that's way over here. The Teres major, which is in the back of the shoulder, the Extensor Carpi, Radialis, Longus, and Brevis, which is right there, but also the Coracobrachialis and the Scaleni Minimus. So the Coracobrachialis is here, so take a look right here, and then the Scaleni Minimus right here. So the Subclavius. So all these muscles, there's so many muscles up here that are causing the pain in the forearm. Isn't that interesting, guys?
Very interesting.
I'd like to introduce. I'd like to introduce our guests. If we could have, you could stand up for a minute. Okay, so
that's as high as I stand. He stands a lot higher.
Yes. So today, do you have any forearm pain?
A little bit.
So this is Camille. She's a massage therapist, and she's been assisting us with many things in the workshop, and also with our ending song, our theme song.
Yes.
Our That's great.
She's the star of the
Oh,
piece.
Yeah, that's it.
No, you're the star.
Okay.
Okay.
Then we have Tim. And do you sometimes have some forearm
Sometimes
pain?
forearm pain, yeah, elbow and wrist, but in the middle, that's the forearm. So that's driving a lot of things that does need work.
So,
So
that's one reason
yeah,
he came.
glad to be here.
He wants to get rid of any forearm dysfunction and
Yeah.
any pain that he has, and elbow and wrist.
Mhm.
Yeah. So we'll take a look at that for you today.
Good.
Here for
And,
that.
and okay, Linda. So tell us about. Have you ever had any forearm pain?
I have had it. I'm not having it currently, but
Okay,
I do
okay.
have some of the other muscles that are involved, like the subclavian stuff
Right,
going
right.
on. Yeah, so other
Okay.
things.
Linda's
So
just here to show us what a pass looks like on all the range of motion.
Not all.
Not all.
No,
No,
not all.
a few things.
So we're the before and she's the after. Right?
No, that's not the case. Not after.
VJS Boone, I saw you are mentioning that you didn't get some credits yet. I'm sorry I can't follow up with you about that right now, but if you'll follow up, via email at info@myopain, I'll also make sure that gets paid attention to. Okay, we'll see what. Yeah, I'm sure you. I just haven't been involved with that. VJS Boone, I don't know your name offhand. All I can see is your Periscope handle, so we'll follow up with details about that. I'll pay personal attention to that for you.
Good, thank you. We want to get our CEUs, yes.
Yeah.
So you can get 2 CEUs for every time that you're watching live.
Yeah.
So that's always good.
Shall we?
Yes. Okay, so one thing that we want to look at too today is the nerve roots and also nerve compression by the muscles. So the nerve root compression by the multifidus, rotatories, and the other muscles right along the spine. So that's important. But also some of the muscles, like the scalenes, the triceps, and also the Coracobrachialis, they compress, also the Extensor, Carpi, Radialis, Brevis, compress some of the nerves. So I was going to show us that, a little bit about that.
Cool.
Okay, so that's really, I think, exciting to know that we can fix nerve compression caused by the muscles or by the soft tissues.
It is.
Mm-hmm. So I made a little thing up explaining a lot of the muscles and the kind of compression and what kind of symptoms they have when they have the compression. So the muscles we'll be treating today, the anterior middle scalene, can cause impairment of the venous flow and cause your hand to be all swollen and digits. So some of the digits, the whole back of the forearm can be all swollen, but the first, second, and third digits might be kind of stiff. Maybe even the whole hand. And then you can have also a compression of the brachioplexus, which could cause dysfunction in most of the muscles in the whole arm and the chest. So that's important to note. Then also the scalene can cause compression of the long thoracic nerve, causing wing scapula to wing out. And we could also have compression of the musculocutaneous nerve from the brachioradialis. The coracobrachialis. I meant to say coracobrachialis.
Yeah.
And I have really some great pictures to show you about that.
Ooh.
Yeah. Oh my gosh, you guys.
You like great pictures.
Okay, so I'm just going to show how the radial nerve here comes through the triceps, and that's one reason that we have compression of the triceps by and then this is the kind of numbness that it would cause to you guys. So this is the kind of numbness. So if you have the triceps being compressed, so this is the kind of numbness that you can get down into the hand, the thumb and the first 2 fingers, and a little bit of the fourth. Yeah. So that can be. But then let's look at if you have compression of the musculocutaneous nerve. So this little muscle right here. So all of us, let's just feel the coracobrachialis that goes here to the right there to where it attaches to the scapula, and then over here to the humerus. And it goes like they can do. It can compress the nerve right here. See. And it can cause numbness right here. So that's exactly where we're treating. So the area that we're treating today, this muscle right up here could cause numbness there, you see? So it's important for us to treat all this chest area that can cause some of the numbness into the hand and into the forearm today. Also, we're going to be looking at the nerve roots here, and you'll see that we'll be looking at C2 all the way to T1, and you can see how what areas that they affect. They can affect all these areas. So all this green area can be affected by compression of the little muscles along the spine. We'll be looking at that today. So those are a bunch of our things. Let me just have a look at one more thing here. The triceps, like I said, compresses the radial nerve and causes paresthesia over the digits 1, 2, and 3. The extensor carpi radialis brevis also causes the paresthesia over the dorsum of the forearm in digits 1, 2, and 3. So those are the things we're going to correct. Some of the things we're correcting
gonna
today.
correct them.
Yes, we are. And also, we're going to correct the referred pain patterns. So this is what we're going to do. So the infraspinatus is a muscle here in the back of the shoulder. So can somebody be my model? Want to be? Oh, you're going to be. Camille's going to be my model. Okay. So here's our muscle here in the back of the shoulder. So it's right here. And we've had some trouble with that, right? You've had a little trouble with that.
What don't I have trouble with? Come on.
Okay, so this muscle here causes pain, guess where? In the front of the shoulder and down the outside of the forearm here, right here. So this is where it causes pain.
Okay.
So we're going to be looking at that muscle. So that's the most likely one to be causing the pain right there.
Okay.
Would be the infraspinatus, yeah. So that's our first muscle. The second muscle we're going to look at here is the scalene. So they're the second most likely to be causing pain here in the forearm. Okay, so let's look at that. So we'll look at Camille again. So here's the scalenes. So here's the sternocleidomastoid. Here's the trapezius, and between it, right here, is the scalenes attaching onto the first and second rib, and that muscle can cause pain down into the forearm, the posterior forearm. Here, the posterior forearm, and also right here on the radial forearm, the two areas that we're treating today. So that plus it causes numbness. Guess where?
Where?
You're gonna make me think today? Come on, don't do that.
Where?
Okay, it causes numbness on the little finger side,
Little
or the
finger.
ulnar side. Paresthesia on the little finger side. So it causes pain on this side, on the radial side, and paresthesia on the
Interesting.
on the
Got
little
it
finger
all
side.
covered.
Yeah, isn't it incredible?
Oh.
It's just incredible. Because that's the second most, third most likely.
Someone accurately guessed that in the audience.
Oh, did
Yay!
they? They did. That was great. Give them a piece of chocolate.
We'll give you a star. We'll send you a star.
Hey, next week everyone gets chocolate for Valentine's Day.
Oh,
right?
we do have to have chocolate. Yes.
Okay.
Remember, we're getting together next week. You could now.
True.
What I recommend is bring your sweetheart to the class, and you're gonna treat them, and you're gonna measure
Fix their
them.
pain problem.
Fix their pain problems. What do you think?
Really steal their heart.
That'll do it, right?
I don't know if it'll be seller.
They can still have dinner afterwards.
Wow.
Okay.
Okay, so the third most likely one is the brachioradialis right here. And so this is our brachioradialis, and it attaches onto the humerus and then onto the styloid here. So then, again, we're treating this area and this area, and it attaches here onto the humerus and then over here. So and it causes pain right in that area. And it also really down in here into the web right there, really pretty significant,
Right into
and
the
causes
web.
really very significant lateral elbow pain. So like tennis elbow. Yeah,
Right. And that's
So
what we worked on last week.
we sure did.
Yes.
Yeah, that was it. Okay, the fourth most likely one. Okay, and let's see if we can find it here. Third.
Supraspinatus.
Supraspinatus, let's find it. Here's the infra, it's right near the supra. Okay, so I'm going to go right over here. This is right near the supra, there it is. So here's the supraspinatus, and you can see it causes pain on the outside of the shoulder, the outside of the right there at the elbow, and then down the outside of the forearm. So this is our supraspinatus. So here's our muscle, so it's right there. So let's look at it on Camille. So here it is, so you find the spine of the scapula here. You go right above it, that's your supraspinatus right there. And then before
On
we were
top
talking
of the
about the
spine of the
infraspinatus. Yeah, the spine of the scapula. So this bony
Yes.
part right there, that's the bony part.
Yes, we gotta get our spines clear here.
So we're gonna look there so you can see where it causes pain. Okay, and then let's look at the fifth most likely one, the subclavius. So here, this is just, look at how much pain this causes in the arm. Come over here and take a look at this. You won't believe it. Okay, so see, this is just, look at how tiny that muscle is. So it's just below your collarbone, right? This is their subclavius. and look at the pain it causes. The front of the arm, okay, and then right where we're treating to there, the radial, the outside of the thumb side of the forearm. It causes really significant pain there. Isn't that amazing?
All the way down to the hand too. Huh?
Yeah, all the way. Oh, it's so amazing. It goes down, and actually, it seems like it's carpal tunnel syndrome, doesn't it? I mean, to a person, you might think, "Oh, I got carpal tunnel syndrome or something like that." It goes going down my arm like that. And look, it's just this little tiny muscle here. So this is a really important muscle for us to treat to eliminate pain in the forearm, even though you wouldn't think it would be. Okay, so let's take look at where it is.
Yeah.
So it's over here. So it's attaching right here, and then come onto the costal cartilage there, and onto the subclavius there, the clavicle, the collarbone, and then over here to the rib. So it's attached. So what it does is it lifts the rib up, you know. So it anchors the collarbone and the. Oh, it mostly it mostly holds the collarbone down. I'm sorry, I don't know why I said that.
Yeah.
Okay, so let's feel the collarbone go down. So like take your collarbone down, so up and down. So it just depresses the collarbone. Yeah, and take your collarbone down. So there, yeah. So that's mostly it. That's all it does.
What are you asking her to do when you say take the like?
Oh, so
breathing?
here, so when you're
Kind of breathing?
so you could sort of depress it and.
Oh,
and
okay.
you
So
could
moving
kind
her
of-
shoulder up
You
and
could
down.
kind of,
Gotcha.
you could sort of depress it and elevate it.
No, I
And
was
you
doing
get
it without moving my
But,
shoulder.
but you know, you're trying to get this little muscle here to work.
Yeah.
Yeah, so it's like you're trying to get that. So the only way to really feel it work is to just feel how it moves a little bit when you're breathing, and then also
So
this.
breathing and moving the shoulder
Yeah.
up and down will get it to move.
Yeah,
So if somebody does a lot of chest breathing, they could overwork this muscle.
they could. It could. Yes, it could. But I think a lot of times the main thing that gets in trouble with it is if you're kind of like doing more like
hunching-
this.
hunching
If you're
over.
kind of like more like this, it gets stuck right there like that. And I think that's its main thing. It just gets stuck in the short position.
So like reading computers, cell
Yeah,
phones.
so like this, everyththing that
typing.
typing like this,
Modern
everything's
life,
like this.
modern life.
Modern life. Modern life.
We're really modern life is indicted here.
Driving.
Yeah, yeah.
So is it not enough
Uh-huh.
to just treat that one muscle to relieve all of these
Yeah,
symptoms?
it would. Yes, it would. It would. Yeah, but it's just that. But keep in mind, though, the reason that myself and Dr. Simons put this together is look at how many muscles cause pain in the same spot. So yes, it does fix it. If
So
that
it's a
was
process of elimination.
yes, but you might have to fix every single muscle that causes the pain there. But this is still significant. It's still super
So
significant.
if you do that and all these symptoms are gone,
Yeah.
then maybe you don't have to do the other ones.
Correct. What if you just treated one muscle, so you could treat the most likely? So what's the most likely one?
Well, on the top of the list.
The
The first one.
Infraspinatus.
So the first one. So the most likely would be the infraspinatus and the triceps brachii would be our most likely ones for the 52 and the 54. So here, so the most likely one is the first one. The second most likely one is this scalenes. The third one, the fourth one, the fifth one. Then the same thing here for dorsal for the pain in the back of the forearm. It's the triceps, the Teres major, the Extensor Carpi Radialis, Longus, and Brevis, the Brachioradialis, and the Scalenus. Oh, did I say it wrong? Sorry. Coracobrachialis, and the Scaleni Minimus. Okay, so this is, so many muscles can cause pain in the same place, but we could go with the most likely one first. You know,
You
and
get
then
You
you
know,
someone
it's
can
the
say-
muscle that you use to pull the cork out.
yeah, yeah, try that one first.
We just had someone say they had a client come in who was going to have surgery on her wrist, and they used the protocols from last week on her, and she improved.
All right.
So were they thinking maybe they might stay with the
Cancel.
treatment?
He said he can't wait to try this week's protocols on her.
Great, great. Good. I've had that happen so many times.
Well, I guess she hasn't gotten surgery yet. Yes.
Yeah, yeah. Well, so many people have come to me before surgery and after surgery, and I was able to help them in both cases. But it's certainly, if you see good results, sometimes people cancel their surgeries because they realize this has helped them and they don't really need it anymore.
Yeah. Yeah.
Yeah. So it definitely worked.
Good to avoid it if possible.
Yes, yes. So, okay, so let's take a look at the 6 most likely here. Okay, so that's
For
5.
dorsal
Okay,
now
now we're
getting
going to go to
into
dorsal. Yeah,
Triceps brachii.
yeah. Now the most likely is the triceps. So again, let's take a look at the triceps. So here's the triceps is the most likely one to cause it in the back of the forearm, right here. The back of the forearm. Also the lateral epicondyal pain that we did last week but also the back of the forearm. So it's the most likely one to cause that. And you can get different parts of it can cause it. So this is on the inside right there, and also on the outside. So different parts of the triceps can cause it to hurt in the forearm right there. So both the inside and the outside of the triceps here. So the inside of it and the outside. So we'll look at all those. And then the next one would be the
Teres major.
Teres major. Okay, let's take a look at that. And that one, so the triceps, what does it do, you guys? What does it do? Let's take a look at it.
What does it do?
So it extends the elbow like that. Yeah, it does that. And it brings the arm, brings it close to your body like that. So one of our tests is how it can bring it close to your body like that. So it just extends the elbow itself and also extends the whole arm. So let go. So it extends the whole arm and it extends the elbow. Okay, so those are also little jobs. So that's kind of fun. And we're going to take a look at the Teres major. Okay, let's take a look at it here. So this is our Teres major. And you can see what it does is it attaches here into the humerus and then onto the scapula. And it rotates the arm. Which way? Which way does it rotate it?
Which way?
Inward, like this.
Inward
Okay,
like
so
that.
this is what it does. It rotates it inward, so let's all do it inward like that. Then outward, as its contraction, and stretch like that. So here we're doing, so here's its contraction,
Using our Teres
here's its
majors.
stretch, here's its contraction, here's its stretch. Okay, so then here's where it is. So here it attaches onto the scapula, and then onto the humerus right there. So between here and here, okay? So and it goes like this when it contracts, and it goes like this when it, so there it goes like that. Yeah, contracting and stretching. Okay, so that's great. That's a great one. Let's take a look at the next one. What's the next one? The Extensor, Carpi, Radialis, Longus, and Brevis. So here it is. It's attaching right here to the humerus and onto the third metacarpal. So let's take a look at that on you. So here, it's attaching onto the humerus and then onto the third metacarpal right there. So here we go. So right here. And so that's a good stretch for them. A good test would be to go like this and see if you can do the 90 degrees.
I think I know I have some issues with that one.
Mhm.
Wait, so the test for that one is when,
So this is
when
the
your
test.
wrist is
Yes,
bent
can we
or
do-
no?
So it's so important, you
one's
guys, as therapists and anybody who wants to use their arms, we have to be able to have a right angle. So you want to be able to have a right angle here, so you want to get them to both have right angles. You want to do it also with the fingers. So without the fingers, with the wrist, you should have a right angle plus, okay? And then also with the fingers.
I have the issue with the fingers. When the fingers are bent.
To
It
fix
starts
that.
tightening up in here with the fingers.
Yeah, the camera people almost always have the trouble then. Yeah, so that's real important. Yeah.
Yeah, tightening up with the fingers.
Mhm.
We
And
have
it
a
can
most
cause-
frequent viewer title that has been stolen from someone else.
What?
I didn't know we
We
had
have
a
to
title.
give you a star. We'll send you a star.
Ah.
Uh-huh.
Everyone, gold stars.
Okay. All right, so let's look at the next one. What's the next one on there? The Coracobrachialis.
Coracobrachialis.
Okay, great. So let's take a look at that. Here it is. Okay. So here's the Coracobrachialis, and remember that's the one that has that nerve that gets compressed that causes the numbness right here, right in the area we're treating today. But look, it causes pain in the front of the shoulder and on the back of the forearm, right there, and into the hand. So take a look at that one. So this is that Coracobrachialis muscle right here. Remember, let's press on it and see if we find any painful spots. So right there, and that's that muscle that it can cause, it can compress the nerve. And I might have a cute little picture of the nerve compression, but here's the muscle right here. Yeah, but sometimes I have a nice picture of the nerve compression, but not today. Not today. I see. I didn't put it in there today. But you see how it attaches onto the front part of the scapula, the coracoid process, and then onto the humerus there. And then it flexes the arm.
I'm guessing that one would be another
Adducts
like
the arm.
another one that's a victim of leaning forward and doing stuff on
It
phones
is.
and
It's
stuff.
totally. It's a totally a victim of that one. Yeah,
Yeah.
it's a total victim of that. Yeah, totally
Fetal
complete.
position. type
Yes,
thing.
yes, it is. It totally. That's it. Okay, we hit them. I think the Scaleni Minimus.
It's hard to get out of fetal position.
Okay, we got one more. The Scalene Minimus, okay?
Try.
Should we try? Try. It's hard to do. It's hard. That's it. We have to contradict it.
We want to hug
It's,
our pillows.
okay, it's time to get out of the womb.
Oh, okay.
It's time to get out. Okay, see here, the Scalene Minimus. It's got a really interesting pain pattern. But look at where it attaches, you guys. It attaches right onto the pleura of the lung and onto C6 and C7 there, okay? But guess what it does? Let's take a look at the pain pattern. Let's see if we can find the Scalene pain pattern here. Yes, we can find it. Okay. So,
Minimus.
so very frequently, let's find it on you. So here it is again. So let's take a look. Here's our trapezius. Here's our sternocleidomastoid. And in between it is right here. Right here, that's our scalenes. But the Scalene Minimus is right. Okay, let me. Okay. In order to get it, we have to put it off the stretch. Okay,
off the stretch.
Yeah, a little bit off the stretch, and it's right here. So it's right here, and it attaches. You can see inside right here, on the pleura, and then on to 6 and 7. But look at the pain pattern. But look at the pain pattern. See, this is what I'd like you guys to think about. What happens is when you get rid of this pain pattern, that's kind of like it's really big on the forearm and into the hand. What happens is when this one goes away, this one often shows up, because what happens is when right attached there at C7, there C6, C7, what could happen is that it never had to stretch or do anything
Didn't
before.
have to work as much.
As soon as we fix these, this one has to work, maybe, you know.
Yeah.
So sometimes that's a good sign to have this new pain pattern. so that's in the back of the forearm there. So that's the least likely one, but it's still.
But she thought even it was cousin Camille, so some significant
Yeah,
discomfort.
My scalenes are
They're rough.
always.
She's had some trouble with them. Yes.
always
Yeah.
activated.
Yeah, right there.
Oh yeah.
So that'd be right there.
And I'm feeling referral in the back.
Oh, she's feeling exactly that one. Yeah. Okay. So
I have memories of that pain pattern.
she's had that one. Okay, so that's so we're going to take a look and do some nice, interesting tests. But we just took a look at all those pain patterns, which is very interesting, and the shapes of the muscles and some of the interesting. Now we're going to take a look at some of our tests. So you can get these on our website. These are tests. This is one of the versions.
At myopain.com, where you get the protocols as well.
And we're going to take a look at different tests, and we're going to test each other a little bit, and see. So did you pick up one of these? Yeah. So we could do it together. We'll do some little tests, and then we'll put your name on the top of one. We'll put your name, Tim, on the top of one, and put your name on the top of yours, Linda. Okay. And if you could get a little tape measure that's over there, I think we'll do good with that. Okay, so today we're going to use a tape measure.
Tape measure today.
That's what we'll need, a pen to write things down. Put the person's name on your piece of paper. Okay, so Tim, if you could put Linda's name on one piece of paper. Linda, if you could put Tim's on.
T-I-M.
Oh, yeah. Could you spell that correctly for you?
One M.
That's
One T.
That's a rough one.
One eye.
One I, yes.
Oh, I got mine here.
Oh, okay. All right, good. Okay. All right, so good. Thank you, Camille. All right, so we're just going to look at a few things, and we're going to take a look at Camille. So if you guys could do it together, could you test Tim?
Sure.
T-I-M.
Oh, Tim.
Tim.
Okay, so here we're going to take a look. So you can see she probably has a little restriction. So on the chart it says if you can't do the cervical rotation, these are the muscles that are dysfunctional. And that one of them is the scalenes. So today the scalenes could be bothering her. She's not passing that
That's the main
test.
one we're testing for today with this area, right?
Yeah. So the nose should align with the acromion. That's 80 degrees of rotation.
Okay. Nose aligned
So
with
no.
the acromion.
So here. So we got a few inches from her. Turn to this.
So what are we doing?
So here's the acromion. So we're about. That's the acromion. So anyway, you could just say she doesn't pass. You know. So one is just pass and fail.
Okay.
So here, so we're going ahead.
Okay.
So,
Okay, so what do we
so left and right, so fail, okay? So let's take a look to this side. And so here, you guys, okay, you're gonna do him?
Well, yeah, I don't know what we're doing, so I'm gonna imitate what you're
Yes,
doing
do it.
behind you.
Exactly.
But I gotta follow you, because
Yeah,
I don't
yeah.
know what the heck we're doing.
So we're just gonna see, can he rotate and get his nose to his acromion?
Which way? Doesn't matter.
One way and
do
then
both.
Both ways?
one way, then
Testing
the other.
both ways.
Okay.
So
So
nose to the
Yeah, nose to the
No
acromion.
reaching. No reaching.
straight. I have to
Tim.
go
Yeah,
straight.
yeah, so that's not passing, because it's not going all the way, yeah.
6.
But it's close. No,
Just
I
a
just
pass
don't
fail.
bother. Just
It's
don't
It's like a
bother.
summer school class.
Yeah, it's
pass
like a
fail.
pass fail,
Yeah.
like a summer school class.
Okay, did I feel on
Okay.
the right also?
Okay, let's
Okay,
do,
the
let's
other
do this,
side?
let's do lateral
I might
flexion.
as well not show up to this
Okay,
class because I know I'm failing this one.
Oh, this is good on this side. Here, look at that. Okay, so,
I don't think it passed.
No.
You can do me.
3 of Sharon's fingers.
Okay, here. 4 fingers
4
here,
fingers.
and here, 5
That's
fingers.
probably not
Okay.
pass. Is this not a pass shape?
Left
So left
5.
5 fingers.
Yeah, you want it to align, the nose to align with the acromion, about there. So she's a little,
Like that?
she's close to passing.
Is this
but-
a pass?
So you want the nose to come to the acromion. So
I mean, like all the way down or just
yeah, no,
parallel?
just parallel.
Oh, parallel, okay.
Yeah, so she's supposed.
Oh, that looks good.
Getting pretty good. Pretty
Yeah.
Good.
That's pretty
So
good.
it's just so between here and here is about 1.5 inches.
There's
Yeah.
someone
That's
saying they
good.
have some popping in the gleno joint when they're rotating.
Well, okay. So what I like to do is
That
get my
does that feel
finger
uncomfortable?
right on the
Forearm out
noise.
and rotate.
Okay, so
Oh,
what I'd
that's
like you to
good.
do is get your finger right on the noise. Okay, so put your finger right on it. Look around for the muscle and move a little bit and feel the muscle that's jumping. And once you find it, really press on that muscle and inhibit it from doing its job.
Yes.
You
Watch your fingers, baby. Watch your
You
fingers.
show that muscle who's boss.
Oh, Sharon.
I often do use that finger. Okay.
It's a working finger. For
Telling you
our
boss.
purposes, not the other purposes.
They're asking, would the left rhomboid trap be tight as well? And they said ACM joint. Someone else
Well,
said ACM joint.
There's a whole bunch of muscles to look for. So I would go. So
That's where she
okay,
feels it
listen.
now.
Wait, okay. Say it again. What's the problem when
She
you
was
do it?
saying with her arm out and rotating that she was getting some popping noise. In
Like
the,
out like this and rotating?
Let's see if they respond. Yeah, she said she was feeling it in the ACM joint. I think it takes a minute for it to.
All right.
Oh,
Okay.
okay.
So we're gonna have to look at that a little bit later.
Yeah, we'll take a look.
On with our test.
Okay, so
Upward
we're gonna
towards the
do.
back, she said.
Okay, so here we're gonna do the scalene finger flexion test. Okay, so this is the scalene finger flexion test. Okay, so we're gonna
Up
let's
against
take
the
a look.
wall.
We're gonna take a look at you. Okay, so we're gonna see how she's doing today. So let's keep your knuckles on the wall and see
Familiar
if you.
taps.
Yeah, we've
Okay.
done this.
That's pretty good. So you're
We do it a
almost.
lot.
Oh, she's passed. Okay, that's passing.
Wow.
Oh, I've improved.
She's passing.
Hey.
Ha
Pass on the right. Okay, and let's see on this side. Keep your hand back there. So on the left, a little bit dysfunctional here, and,
Yeah.
and on 2
It's
and 3
still there,
here.
yeah.
Okay, so almost pass on the left.
Almost passed.
Left,
Pass
2
on
and
the
3.
right.
Pass on
Okay,
the right.
pass on the right.
Wow.
Pass and almost pass,
Mhm.
and that's the first, second, and third. Okay, so that's pretty good.
Yeah,
We
that
got a
does
lot of scaling work on Friday, so that helped.
Yep.
Nice.
Okay, so we're gonna do the mouth wrap. So remember that one. Oh, look at that girl go. Okay, so here's the mouth wrap. So this would be 3 inches. So that's not too
Oh,
bad.
that's improved.
That's better. So mouth wrap. So that was the
Right,
Mhm,
right 3.
So minus 3 inches, and then this one.
There on the forefinger.
This is minus 2 inches. So you measure from the middle finger to the middle of the mouth. So that's minus 2 inches there.
That's a lot of improvement.
Mm-hmm. Minus 2 inches. So so we're getting closer. So we're going to do the back rub. So that's this one here. Let's see on the other side.
Does this look like a
I
pass?
can do the
Yep.
back
So
row.
the back rub is that you can come across the spine and to the other side.
Yeah, that's
Pass.
that I can do.
She can pass that.
But touch the scapula, haha.
Yeah.
So that would, if you didn't pass that
So I'll
one,
say you
that would
passed.
indicate that you had trouble with the anterior deltoid or the coracobrachialis.
Injury.
Yeah.
Now we're doing
Okay, hand to the
chin
shoulder
to
blade.
chest. Oh, she's ahead of us.
Oh, that's
So-
improved.
Well, okay, so but keep go ahead and start
Okay.
wherever you want. Go,
Okay.
keep going.
So,
Okay, so
we're
this
gonna
is
do,
5 inches here. Okay,
Patient
I'm not
touch
sure
to
that-
touch
that's
chin
that's
to
good.
the
That's pretty good.
chest.
Without that?
Oh, there you are. A hand to the
Okay.
shoulder blade.
That's okay.
Okay, on the right,
like it.
minus 5 inches.
No, that was left.
Oh, left. I'm sorry, left.
The right is not as good.
Okay, and then right is a little
Which one is
minus
that?
Yeah, right. That one.
Okay,
Number
that's
3.
11.
Yeah.
Oh,
So we'll say pants.
Okay,
And
so
then
we're
we're going
moving along.
Extend neck to back.
Okay, so
Roughly
I think
up
they're
at
doing
the
some of the ones they
ceiling.
don't need to do. Which ones do
only
they
the
need to
ones
do?
that have the little asterisk
Oh,
next to it.
Yeah.
Oh, brother. Okay.
follow Sharon.
We should get extra credit.
Yeah.
Yeah. You can
I want
skip
some of
down
those
to number
stars.
7 there. Yeah.
You'll get some stars for passing things.
Okay, here we
Okay.
are. Now we're on 7.
So it was just the scalenes, and then after scalenes, okay. You got
We
the
did
back
that.
rub.
We did that against the wall.
Yeah, then we
Okay.
did the
Then the back rub.
Okay, then we did the mouth wrap. Okay,
The
then we
mouth-
did the hand to the shoulder blade.
The hand to shoulder
So that's
blade.
your next
On the
two.
back rub, right?
Yeah.
back
Oh,
rub.
back rub,
Well,
back
yeah,
rub.
the only one who doesn't pass that one is Kurt. Everybody else
Some
passes
people
that
don't
one.
pass it.
Yeah, I mean in this class.
Yeah.
Yeah, he doesn't pass that one.
Okay,
either.
so we got the,
Okay.
Those
So
are-
we got the back.
Okay, for the
Where are we?
triceps, we're gonna do the
Triceps.
over the shoulder reach.
Oh,
Okay, so here, we're gonna do the over the shoulder reach, and that is, you're supposed to be able to see the inside of her ear, and we can almost see it, I think.
not too bad.
We can see it a little bit on this side.
Not too
Okay,
bad.
so it's getting better, a little bit better. So it's on the left. Okay, so let's try it on this side. Okay. Okay, on this side, we can't see it. Yeah, it's a little tighter on the
Really?
right.
And that's
yeah.
what you worked last week, the
Oh,
triceps.
well, okay.
And they're still sore.
Well, oh my gosh. Well, sore.
They're still sore from last
Well,
week.
you should make sure to keep
gotta
moving
work
How
it.
on
far is it supposed to
Yeah.
go?
Keep
Yeah.
moving.
Well, I think
Keep
it's
moving
supposed to
them,
be
yeah.
behind the
Keep
ear,
moving
but I
them.
Yeah,
know where it's
yeah. So you're
Well,
supposed
range
to,
of
yeah,
motion,
you're supposed to be able to see the. So you have to look from this side. Yeah. Oh, well, you can go. Yeah, go ahead. Go ahead. So.
This is
so
supposed
you
to
have
be
to
over here?
stand over there. Okay. So can you see her? So she's. You can't see it.
No.
So I don't pass it.
Yeah, it's
No.
real. Yeah, you
You
can't
don't
see it.
pass
See,
it.
you can't see
No.
her ear even. Yeah.
So it needs to be like,
And get behind the
Yeah.
ear.
Oh, wow.
Yeah, yeah.
Okay.
He's
Okay,
really
passed.
got it.
He
He's
really
passing, yeah.
passes that one.
Yep,
He's
he's
doing
got
it.
that one. What number?
Triceps.
What
He's
number
got
is that?
triceps. That's triceps. That's
That's
the. That's the.
triceps.
Oh, 18.
18. huh?
18.
18.
Number
Over
18.
the shoulder reach.
Number 18.
Mm-hmm.
Sharon, are you wearing 2 jackets because it's so cold in here?
Yes, that's the reason why. Does someone wonder?
It's cold.
It's very
I-
But they're both short
It's
sleeves.
true.
Yeah, but see, then
You
this
passed the
still
one.
has my elbows free.
Yes.
Okay, so
It's
still has my,
essential.
but I got it a little bit warmer. I've got a
Yeah.
little bit warmer because it
I
is
don't know
cold
about the
tonight.
hand to the shoulder
Yeah.
blade.
My husband, when
Is
I
that what
left,
we
he
just
says,
did?
Sharon, remember,
We did
it's
the
going to
over
be
shoulder
cold
reach.
tonight.
I know, it was like 50 degrees earlier,
There's
but
no 18
it's colder tonight.
Oh,
Yes,
well,
sir.
in here.
Okay,
After
so
17.
we're
Now
going
we're
to go and do the clamp over your head.
Okay, yeah, that
Do
one.
the clap.
Okay, good.
I
One more
pass.
time and stay there. Clap and stay. Okay, great. Okay, good. Pass.
I passed that one. I get a couple passes.
She passed. She passed.
Oh,
So
the clap.
that means that that she has enough range of
19.
motion in the deltoid triceps and so forth. She's in, but still triceps is still important.
Okay.
On the right.
Mhm, especially in the right. Yeah. Triceps right. Yeah. We still need to work on that. And these were pretty good here. Okay, so let's
Now
go to the
what
next
do
one. Hand grip. Okay, so let's go ahead. We're gonna go ahead and let's go ahead.
You say
And
it's
let's-
60 degrees in Nashville.
Oh!
All together?
So what are we
Okay, so
supposed to
we're
Hello.
gonna measure. So that's pretty strong. Yeah, she's strong. Yeah.
So what are you doing there?
So we're seeing is one hand stronger than the other? So we're looking at the strength, and we're seeing the grip. And we can also just go ahead and look at
Don't feel
one.
strong.
Yeah.
We can look at the other. They're strong. You guys are strong.
This feels like
Way
it,
to
yeah.
go.
70 degrees in Missouri.
70 in Missouri. Wow.
Getting reports from all over the world.
Wow.
What are we doing in Hawaii where Sharon's going to as soon as she can?
So I am going to Hawaii in
So
April.
what was
Okay, so we pass.
20.
Which muscles were you
Okay,
testing
next
with
we're
the
gonna do
hand
that
grip?
was
That's a hand
that was
grip.
number 20.
They felt
Which
equal
muscles?
to me.
So that was the hand extensor. So that's so these are the weak. So these here and these here, are the weak, painful grip muscles. So if you're having trouble with those muscles, you'll have a weak, painful grip. Okay, so a fail for this is when you do it hurts. Like yeah. So you have to you pass. Okay, the next one is the 23, 25, and 25A. So the wrist and flexion. So this one here is what we did before. So you want to be able to get you want to get a right angle plus, okay, and a right angle plus. Okay, so you want to do on both sides. Let's take a look.
No.
Right angle. No. Okay, but let's take it. We could look at the. Does it fail today? But it's better than it was before.
Yeah, it is.
I can do it,
It's
but
not
I can't do it
horrible.
with my
Oh no,
fingers.
it's much better than
I
last
can't
week.
do it past. So that I think is 90.
Okay, it's
but
better.
doesn't go
Relax a
forward.
little
Yeah.
bit.
This one
Don't
I'm
make it a
not
really
doing.
stiff
Maybe
fist.
half,
Okay.
45.
Yeah.
Oh,
Loose
okay,
fit.
and
A
this
loose
is,
fit,
this is
yeah.
the side that you have.
So here it's
trouble,
still.
right?
So
Yeah.
we need a little bit
Right
more.
side.
Okay.
You're gonna both.
72 in Orlando.
Okay, so you're
72. My
Oh
gosh.
my goodness.
Yeah, she's gonna be in Hawaii in the whole month of April. Whole month.
Guess what?
He was saying he's gonna be in Maui, so he's
So what did
Oh.
you say? You're right.
Wow. Maybe we'll
45
see
degrees.
them.
yeah.
him.
Are you going to Maui too?
I wasn't, but maybe they'll come
And
to the
left
big
people
island.
do 90.
You never
Yeah,
know.
but I couldn't get past.
Okay, we
Like
did
left
it.
Said,
Okay, we're done.
We did our
Did
test.
you guys let's see how you guys are doing?
We did good. We did good. We missed a few.
Isn't that great that you did them? Wow, you're fast.
Some trouble with the.
No, we're not. We're behind. You're too fast for me.
We did good.
I'm
we
still
did
reading it. I'm still looking for the number.
good. Okay,
So
so
we got most of them.
all right. So we're gonna treat some of these muscles. Okay. So let's take a look, and especially let's take note of the muscles that you didn't pass the range of motion tests. Okay. All right. So we're gonna treat. We're gonna use our protocols. So let's use our so everybody, if you can, you're gonna download protocol 52.
52 and 54.
And we're going to start with the most likely one in 52, which is infraspinatus, then scalene, then brachioradialis, then supraspinatus, then subclavius. Okay.
Yeah.
And often when we're going to do a muscle, we often will color it, so we know that So often I'll color it, and then I'll put the tool next to it that we use to treat it. So I'll color the infraspinatus and the supraspinatus, and then we're going to probably treat it with a ball
Yeah.
on the wall.
All on wall.
So that'll be good. I'll do a ball on the wall. So that'll be good for the supraspinatus, and then we'll go on to the next one. We'll probably do the scalene here, and we'll do the scalene, and we'll probably use a back knobber. We'll use a nice back knobber, but you could use other tools too. So we'll use a back knobber, or you could use a jack knobber, or you could use an index knobber like this.
Any kind of knobber.
Any kind of knobber. And then here we'll go to the subclavius, here right below the collarbone, right there. Attaches here, right here. And we're going to treat that. We'll probably use the back knobber tool like that. So that's a few of our. Then we'll go on, and then here's a lot of nice little stretches and things for us to do for this one here. So, all right. Let's go ahead and give it a try. All right, so let's
Ball
get
to the
some
wall.
nice tools, and let's start with a ball, and so let's get us a ball and get us a back knobber.
These balls or the tennis balls?
Let's get a tennis ball size one,
Smaller balls.
Tennis ball.
and then a back knobber. Give me a little ball too. Get a little ball.
Okay.
This one?
Let me get around this way. Thank you. Look at some balls. So get a little ball. Get one of these. Okay, give us a back knobber. Okay, let's have a nice back knobber for. I'll give you one. Get one for you, Tim. You can have the blue one. Do you like that one? Okay, great. Then I'll take the red one. Okay, and this is a good one for people to use. So if they don't want to have to pick up their ball.
Ooh,
You don't have to drop it. Okay.
that's handy.
Like we were doing the one the week before, the ball kept on.
Kept
Falling down.
Right.
Oh yeah, they'll fall down on us.
All
Okay, so we'll start with our infraspinatus. So for that, let's do it on the wall. Let's come this way, and we'll do it on the wall. So again, we want to be able to pass the infraspinatus test. So one thing we could do is treat the infraspinatus while we're trying to pass the test, and then look around for taut bands and look for a spot that lets your arm go up higher.
So you're doing the back rub.
Yeah, so we're doing a nice back rub here.
Back rub, range of
Well,
motion.
actually doing the hand to the shoulder blade.
Hand to the
But
shoulder blade,
but
yeah.
what if we could only get this far? What if we could only get this far?
Yeah.
Then we can put it there.
However far you can get.
Yeah, then you can put it there. And then you could get right on, for this one, you could do Coracobrachialis in the front, okay? And you could get it right here on the Coracobrachialis, and then press on it and then see if you could get it up. So there's other ways. Right now we're on the infraspinatus. And here you could try this with the ball and the sock.
Oh, okay.
And is that a product from Tiger Tail?
No,
the
this
ball
one,
that
this
you
one
have in your
is,
hand?
yes.
Yeah.
This is a product from Tiger Tail, and this is a product from Back Knobber.
Yeah.
Pressure positive.
Pressure positive, that's right.
Okay, so let's do it on the other side. So let's go ahead. So this is,
Oh, yeah, that's great.
Yeah,
so
that's
she
nice.
likes it. So she likes it.
Very good.
So this is just a nice sock.
Ball and sock, good idea.
Mhm.
Yes.
Ball and sock kind of thing. I said this to somebody yesterday, a guy, and I was saying, well, you could put your ball into a stocking. He goes, not me.
A sock, though. A sock is okay.
Not as stocking though.
Never a stocking.
The things I do that offend.
And we thought this was a family program.
Oh. Hey,
We need to put you on a 10-second delay,
I'm
Sharon.
laughing and they all say, sock it to me.
Okay, so now we want to get the supraspinatus. So we're going to find that ridge, that bony part on the shoulder blade. We're going to get above it, right above it. So here, see, we're going to get right above that part. So then,
What a tool.
yeah, we get right on there. Now, Raven, do you know how much this tool is?
I don't. Is
This
it
tool
like-
is
yeah.
probably a little around $20 or so.
That's what I thought.
Yeah. So this is, and the tennis ball would be less, but
I don't think most tennis balls are $20. They're
No,
probably
no.
a little bit less.
Yeah.
but don't you like it though? Still, it's really
Very
good.
nice.
That's right.
Excellent demonstration.
We like the Cadillac version,
Yeah.
and it stays right where you want it. It's a little harder, so that's nice too. So it's nice and hard. So here you get right onto the attachment, onto the outside of the shoulder, right there. So it comes. So let's feel the chromium right there, the top part of your shoulder, and that's where it attaches onto the humerus, right there. So you get right on that part right there.
Mhm.
Okay, let's go to the other side,
Nice.
and we'll get right on that.
You're
Get
pretty
right on
adept at this.
Oh, yeah,
you
you
like
got-
this tool,
she's
don't
done
you?
it a bit.
I do like it. I do. So find that scapula. So here, and again, you can put your hand underneath and see if you can't get it over to the other side and high up as you can. Like get it as high as you can. You're gonna get it over here.
I think Tim might like a try at the tiger tail ball.
Oh,
He's having trouble
I have
dropping
one of
the
those at
ball.
home.
Do you?
Oh, you've seen it before.
Or maybe Camille would like to try it.
Would Camille like to try it?
Sure.
Yeah, Camille, give
Having
it a
some
try.
trouble dropping it.
Tie it around my neck, that way it won't fly.
There you go. Different technique.
Hold it
Okay,
like
so again,
this, set it like
Right here is where the supraspinatus attaches onto the humerus, and we want to get right there. So you feel the acromion, the top part of the bone there, the
Yeah.
shoulder bone. Now you're going to come like this, and you're going to look for a painful spot. Sometimes that can be really painful, right where the muscle attaches onto the bone.
Now you're. My problem is
she's
catching you. I'll have to give you the sock back.
Yeah, I demonstrate how to drop the bone.
And what is this doing?
You're having a good
Can we
time?
get
Oh,
it?
yeah, this is
The
nice.
attachment
Yeah.
to the
Not
supraspinatus.
falling.
Oh, the attachment.
Just like
Attachment to
easier to maneuver it
supraspinatus
with
right
the-
there. Yeah. We'll
With
do
the
the
way you
attachment.
can hold on
Well,
to the
it's not as slippery as the tennis ball is.
Yes, that's true.
Yeah.
It's a rubber
Totally.
ball.
It's
So what's
rubber.
really good about that is it's hard
It's rubber.
and it sticks on the wall.
Sticks on
Yeah.
the wall, yeah.
It doesn't. It stays right, and then even
Yeah,
if it,
so many
without,
factors.
It
even
stays.
without it stays better.
Yeah,
it
This
stays.
girl knows her balls.
Stays better.
Mine out of the gutter.
It's going to be an X-rated program before you know it.
Okay, so the Brachioradialis we're gonna do. So that tool is good. So you can.
want this
Do you mean the
No, you can
Coracobrachialis?
Oh, is it
Again?
the Coracobrachialis?
Yeah.
Okay,
Well,
sorry.
that's not. We're not doing the.
I thought it was
Well,
the
we probably-
Brachioradialis.
Right? Is
Okay.
it? Well, let's see. Let's see. Are we doing? Yeah, we are doing brachio.
Brachio.
Oh, Brachioradialis, yeah. So this is the third most
Oh,
likely one.
okay.
Yeah,
So
well,
this
we
is the
get
one that
brachio
causes
today.
pain right here, okay? So this is the Brachioradialis, and it touches right here onto the humerus, and so we're going to get right onto it right there. Yeah, right here.
Okay.
It touches all the way here, right here.
Oh.
Look, it touches up high, like
Oh,
here.
okay.
Yeah.
Yeah, so right there, and then we're going to come right onto its attachment, and then with the thumb towards the wall. The thumb
Towards the wall?
Yeah, that's
Oh.
where its trigger point. The thumb towards the wall. The trigger point is right there.
Okay.
Maybe you hang onto your ball so that it doesn't fall. Okay, or you don't have to.
I don't have to.
Yeah.
Then-
Look around for your tough
She
man.
doesn't have to.
You get right on there. So your trigger points often are right here, right there. So you look right there. Oh, you can find one that goes up to the elbow and down to the wrist, and across the
Did you do
forearm.
this last week for the
We
tennis
did
elbow?
we did do it.
But no tennis balls.
We did.
Yes, we did
You used tennis balls?
Yeah, I did.
Yeah.
And then you're going to come down here to the styloid process right here on the radius, on the thumb side of the forearm right here. So you're looking for painful spots in this muscle. And once you find, I thought the most tender one was up here. Would be likely to be there. That'd be your the most likely spot. Okay, so we can take a look. Are we able to really do a good job of bending? And can we do a good job of rotating?
Ouch. Someone says ouch.
Oh, that hurts, it hurts.
And now, what enables you to bend the fingers when you're also?
Oh, the
Yes.
finger flexors and the finger extensors. So the finger
But I mean to do it
extensors-
simultaneously with this, because I could do that, but then when
Uh-huh.
I do the fingers, I can't do the fingers.
Right. So the
This is what I need to work on.
yes, correct.
What we've been doing.
The next thing.
Oh, the next thing that's coming
But
up.
we're gonna do one more thing. We're gonna do the subclavius, and then we're gonna go down and do that part. Okay. So this part we've been doing is the radial forearm pain right here. Then we're gonna do dorsal. When we do dorsal, we'll get a couple more muscles. Okay.
Okay.
So the next one is our
Someone said
subclavius.
that their numbness in the pinky disappeared.
Super.
Cool.
Super. Way to go. Okay. So now, if you could get this little tool here, we could use this little one, and we're gonna get our little subclaviuses. Okay.
No, we're not using
That one we did that way so last week. Last week we did it with we treated
Yeah, you could do
the
that.
chest with the back knobber, but I would do
Let's
it this
see, how
way.
would we
I
do
would
it?
put it here,
Yeah,
the
we
front
got
like
it.
this.
This way,
This is
okay.
very good way.
All
This
right.
is really good way.
So you don't have to use very much
Yeah,
effort
so here
with
so
the
it
leverage.
comes. So here where it starts over here on the sternum, and then it comes all the way
Right
over
in
here.
the collarbone.
Into the collarbone, yeah. And then while you're working on it, see if you can feel the muscle working. See if you can feel it doing anything. Right there. Another way of treating it.
You could use
Okay.
a different type of knobber.
Okay, so usually when I use this tool to treat, I use the other hand to help this hand. So I have one hand, the helper hand, the other hand, the worker hand. So feel the sternum here, and then we're going to press right onto it, looking for a painful spot. And you could sort of move the collarbone so you could feel the muscle there.
Someone's having some referral to their infraspinatus.
Oh man,
Yeah.
right from there.
Yeah, apparently.
Okay, let's take a look at the other side. So here we're going to feel the sternum. Let's come right where it attaches, right there. We're going to come feel, yes, if you're using a little tool. Okay, so for you, let's have you make sure you go right underneath the collarbone. So here, so it starts here, right here,
Mm-hmm.
and then it goes like this.
Oh yeah.
Really,
Oh,
right
yeah.
there, right there,
Yeah.
Jackpot.
right there. See how it's
Yeah.
all the way to here, right to there. Yeah.
Okay.
But look, it's so incredible. But see,
Yeah.
you don't want to miss it. See.
No.
See, you don't want to miss it. So you get right there, and then you get so here's where the collarbone is. Here's where the sternum. You're going to come just to the side of it there. You gotta press right on it. You can sort of move it around a little bit so you can feel it moving. And remember, it causes pain all the way down the arm, the forearm, and into the thumb, the hand, all through here, all through here. So this is a really painful spot. So you get really high by the collarbone. Keep up. Yeah, there.
Yeah, right underneath it.
Right underneath the collarbone.
It's really painful here.
Yeah. And then it comes out this way and comes down. That's its pain pattern. Yeah, there it goes. So it's a very significant pain pattern. It's what's this muscle? Look how big it is. It's not very big, right?
No.
It's like the biggest is your baby
Yeah, we're getting
finger.
reports. Very painful.
Yeah, it's just as big as your baby finger, but it causes all that pain. It's almost like it feels almost like you have carpal tunnel, but it's not. It's got the pain. It's not exactly like carpal tunnel, but it's not numbness. It's just pain. But I just mean people often feel like it. Okay, so
That is the subclavius.
the subclavius.
Right. And I always feel I can breathe better when I work this one too.
Yes, it does help you to breathe there a little bit. Yeah. Okay, so we're gonna just move a little bit. So we'll just rotate the hands in, and rotate them out. Rotate them in, rotate them out. Shoulder up, shoulder down, shoulder up, shoulder down, shoulder up, shoulder down, shoulder up, shoulder down. One shoulder up, one shoulder down. Good. We have good, and forward and back and forward. So let's do our touch her shoulder blade, touch her shoulder blade, touch her shoulder blade, shoulder blade, mouth wrap, mouth wrap, mouth wrap, mouth wrap, mouth wrap. Good. We got him. So
Well,
we're
just
gonna
about ready for a break.
we're gonna have a little break. Great, we'll do it. Let's have a little break.
Have a little break.
Then everyone
we're
get their
back.
protocol 54 ready.
Yeah, get
Okay.
54 ready, because it's going to be time. Get ready to head to the wall again, I'm guessing.
Up against the wall.
Alright. Tune in again at 7:10 Central Time. And there's some upcoming classes that you can think about while you wait.
Hey kiddo, how was California? She always calls me in California when I called her. I thought I was calling the office. And she said, you called her in California. I said, oh, okay. She wouldn't know that the door is not open. Yeah, that's what she said. I carried the stuff in my hands to the car, and I said, oh, I got one in the trunk. I just put my containers to the car. You know, it's just not in my brain yet. I got a million others in my bags too. Those are the heavy duty ones. Thermal bands and a zip. We bought those for $1, $1.50 or something like that a few years ago. And I never used them. Yeah, you gotta remember it. And I got a whole bunch of them that I could, that are real soft that I could roll up, the bigger ones. Just got a whole bunch in the car and, and then I go in the store and forget to take the bag out of the trunk. He's like, I got all these bags in my trunk. What's wrong with me? I'm just not used to remembering those.
Strange weather.
Okay. We are just about ready to get back to it.
They'll keep you busy.
Hey,
Hey.
ready to get back to it?
Hey, we're here.
Protocol 54.
Okay, yeah. So I just was going to review with you one more thing about the Subclavius. It attaches on this anatomy one here onto the costal cartilage of the first rib, but on Travell and Simon's one here, it's attaching onto the sternum here. So it's going all the way here to here. So I guess just the different artists did it a little different.
Interesting. Wait, okay, so
A little different.
that
Okay, we're
one
going to do the scalene next.
compared to
Okay.
that one.
Here it attaches here. Here's attaching here. So, and it depresses the clavicle, it elevates the first rib, protects the clavicle, and downly rotates the clavicle, the sternoclavicle joint. So it's C5 and C6. So, okay, we're going to take a look at the scalenes. All right, we're going to treat the scalenes. Okay, so let's do that right here. We can do it right here. So we get our back knobber. You want to try your scalene?
You like that one? I feel like
How did you do on your scalene finger flexion test?
Yeah.
You did F?
Well, he did okay except for an injury.
Oh, just a little
Yes.
injury.
His
Oh,
pinky.
well, yeah, the little injury, pinky
But you did
finger.
good on the other side.
So, if you want the little pinky worked on, you have to. If you invite me for dinner, I'll fix it during dinner,
During dinner?
while somebody else is serving it to us. Just fix the finger, just the finger. That should be easy. Fix it.
All right, yeah, that's on record. So.
Yes.
Okay, so we get right on our scalenes here, and we're going to go to the first rib. So here it's behind the sternocleidomastoid, in front of the trapezius. Then we go down the middle scalene right here. And a lot of times I like to move it while I'm pressing on it and see how it's doing. I like to stretch all the way, contract all the way, and see if I can get my ear to my shoulder, then I come down here to the second rib, get all the way down there. Then let's go a little bit more posterior, but everything you're doing is almost straight down the side of the neck. So it's almost everything we're doing here, you guys, is just about straight down the side, but you slightly go more posterior for this, what we're doing next. So we're going to go a little bit more posterior, get those posterior tubercles, and we're going to press right on that. We're going to go a little bit posterior, and again, I like to really contract it and really stretch it. And really contract it and really stretch it. Now, for this, I don't press very hard. I'm just giving it a little bit of weight of my hand, not very much pressure.
Especially when you're like contracting it and
yeah, that's
stretching
true.
it.
That's it too. Also, yeah. So now we're going to get the scalene minimus for 54. So for the posterior forearm pain, we're going to come right in here, and we're going to go right in that scalene minimus, right there. Scalene minimus. Scalene minimus. Scalene minimus. And let's take a look at the other side. Now, what's an underlying perpetuating factor in scalene dysfunction? Head forward position. Okay, so what you have to do is learn head balancing, and feel what you want to do is to get one way to get the scalenes to not bother you is we said before, not breathing in such a way that it tightens, but also not having your head forward. If you go forward, you feel how hard the scalenes are.
yeah.
But when you come further back, the scalenes are soft. So you could get used to having them soft.
Yes.
Okay, so eventually.
We get there.
Yeah. Okay, so here we're on this side. So we're starting here. Here's the sternocleidomastoid. There's the trapezius. We're going to go between the two. And now I'm just going to put the weight of my hands on the tool, and we're pressing in, breathing and relaxing. Come down a little bit inferior. And I'm looking for a taut band and a painful spot. So looking for a hard spot and a painful spot. Let's come down a little bit more inferior.
What if somebody gets a headache when you start working on these muscles?
Then you're not on the scalene. You're on the sternocleidomastoid or the trapezius. So your little posterior might be there. You might be on the trapezius. So the trapezius pain goes up, and the sternocleidomastoid pain goes up, but the scalene pain goes down.
Oh, this is good to know.
Yeah, scalene. So you know you're on the scalene. So here, look at where I'm going. See how I'm like way down over here. So like way in
Well, I'm
here.
not having a headache, but I've worked on
You've
I've
had
worked
people-
on clients that
Then
have,
you go.
were
so-
complaining,
so
oh,
what
I'm
if
getting
they-
a headache.
Yeah, so then if they're feeling it over here, then you know, oh, I gotta go a little more forward or a little more further back, depending on what they're noticing. Yeah. Both trapezius and sternocleidomastoid gives you pain right here on the eye.
Yeah, and
But that's the referred pain.
That's the referred pain. That's the
So,
referred pain. Correct.
If you're deactivating the trigger points,
You'll feel the pain when you're doing it. Yeah.
but then it should go away after the treatment.
That's right. That's right. That's right. That's correct.
So
It
just
would
tell
be
them to
like
hang in there.
when you're
and
pressing.
Hang in
we'll-
there. You gotta tell them to hang in
We'll assess
there
after the
Don't
treatment's
give
over.
up.
till the treatment's over.
Yeah.
That's right. That's right.
And
So
we'll
we're
give
gonna.
you a sticker.
Gold star.
That's right. And if it's Valentine's Day, a piece of chocolate.
Yeah, take a chocolate next to it.
Oh my goodness.
So we're looking to get right on that muscle and feel it, and then also let's go to the scalene minimus right here. So let's feel. So you feel the first rib and go medial to the first rib. So feel the first rib, then go medial to it and press right in there, and that's your scalene minimus. That's your shortener, and your lengthener, and your shortener. And remember, it has some very interesting pain patterns. Our subclavius, remember, has this pain pattern down over the forearm and into the hand. So that's definitely one. And the other scalene, which is probably right here, it gives it to you over the forearm, but the scalene minimus gives it to you in the middle of the forearm, right there. So those are the ones
Leslie's
who just.
asking, how do you know if you're on the first rib?
Oh, how do you know? Okay, so let's take a little bit of the stretch out here, so you can feel. So this way.
Let's get in the
Okay,
light.
like the light here. There you go. So take a little bit off the stretch, so you can feel, and then you feel the first bony part here. So you can feel that's your first rib, and then your second rib would be lower down, like there, lower down. So you feel the first bony part, then go above it and in, and that's where your scalene minimus would be. Yeah.
Okay.
Okay, so there we got some nice scalenes there, and so let's do a little stretching on it. So,
Cruel scalene.
oh,
More like.
Okay, so I have some little tools for us. Okay, here's a
Ooh.
stretching tool for everyone.
Stretch and strap.
There you go. Now look, I think I gave you two.
What a tool.
We're not required to hang from the ceiling or anything.
No, nothing like that.
She's not gonna hang us, right?
Okay, so you go ahead and you step on your non-stretchy strap like this, and you have your hand like this, and then you're going to give your scalene a good stretch.
It's the only way the strap stretches is by stretching you. It is
You
not a
stretch.
stretchy strap.
You stretch, not the strap. So you get a good, and then you could go ahead and resist and push away, push, and then stretch, and then push, and then stretch.
So you're pushing against your own hand
Your own
there.
hand,
Mhm.
yeah, push, and stretch. Of course, that stretches sternocleidomastoid, trapezius, levator. Okay, so we're gonna do the other side. So you just put it down like this. This is a nice strap. This is from OPTP is selling this nowadays, and this is a nice strap. You can find that on the
Stretch
internet.
out strap.
Strip out. Yes.
Stretch out strap.
Some people call it SOS.
Mmm.
The SOS strap.
SOS strap.
Okay, so here we're hanging on, and then okay, we're giving it a good stretch, pulling it.
What a stretch.
You could get to your shoulder, your head to the other shoulder, and then you're gonna resist and push away a little bit and stretch a little bit more.
So I think,
Tip your
Tim, you
chin
might
down.
want to have it so your arm is straight, so that you're kind of.
Oh, let's see what Tim's doing.
right?
here. Okay, so do what I'm doing, Tim. So you're gonna stand on it and have your hand pulled down. So it's pulling
Yeah.
your hand down.
You're
So
like
gonna walk
anchoring
it-
your hand.
You're
there.
walking it down like that.
Okay.
There you go.
Yeah.
Yeah.
Now we're gonna pull it. It's to the opposite
Should
side.
help you feel that stretch. Yeah.
Yeah, there you go. Trying to get yours, and then you can resist, and then come down. So you want to look a little bit up at the ceiling, look straight, and look a little bit down at the floor. We get different parts of the scaling. Okay, and this is a great tool for stretching. It's a nice tool. Okay, so
What a tool.
So we're gonna do 54 now. So I got little 54 sitting here.
Protocol
Just a
54.
question, why does it have these
Oh, you could,
openings?
there's so many places you could grab onto it. See,
Yeah.
grab onto it and do all kinds of little different things with it, you know, to stretch all different
Sometimes
ways.
you put your foot in
You
it.
put
or
all
you
different
do
ways, yeah.
legs,
You can find more places to grab it. But really, do you absolutely need it that way? Probably not.
It is nice.
Just a nice rope that doesn't stretch would probably be fine. But I love it for a little, you know,
Yeah,
for
well,
fun.
you could put it on, you know, your arms.
Oh, yeah,
and
you
your
pull
legs
it
and
around.
whatnot.
No, I think it's quite helpful. Yeah.
Okay, so we're gonna
Instead
do
of
the-
having to grab hard
So the
on
first
something.
likely one would be the triceps, okay? Then the second's the Teres major, then the Carpis, then the Brachioradialis, and then the Scaleni Minimus.
Coracobrachialis.
Coracobrachialis. Thank
Tough
you.
when we're doing them
I
both.
like to say that one.
Word association.
Yeah, Corco.
We're doing them both today, but
We have to get to the
moved on
Corco.
now, to the
So we're gonna go
Coracobrachialis.
right to the Corco here. So we'll treat the Corco, and then we'll treat it over here to the humerus. Okay. So the next person we're gonna do here is the triceps, you guys. Okay. So let's try some great ways to treat the triceps. So
We're
remember,
going to the wall.
we could go ahead and use the back knobber like here, and we could get it. Let's get that little section right where it attaches onto our scapula there. So I have a nice picture of it, I think, right here. You can take a look at the shape of it. Oh, that one fell off. Okay. Okay, here's our triceps coming up. Here it is. So here, you see how it attaches here onto the scapula. So let's feel that little spot. Can all of us feel that? So I'm going to
Oh,
show
yeah,
you.
I can feel it.
Let me show Tim
Yeah,
where
yeah,
it is.
yeah.
So here, Tim. So you're going to get to your scapula and you're going to press right there. So let's get right here. And we're going to come all the way over here. So this is where your triceps attaches onto your scapula, right there.
Oh, there we go.
Yeah, right there. And then you're going to come this way. That gets right onto your triceps. And remember, this causes really bad forearm dysfunction and forearm pain. So this is one way of getting it. Yeah, right here. So we want to get the outside right here, right where you are.
Yeah.
And we want to get the inside. So we're going to, right here where it's on the outside, then also we're going to get over here on the inside as much as we can. So for that, I would get right here and I'd pull the tool forward.
I'm going to demonstrate that for us over here.
Okay, so one way to treat it would be to press.
What you got? In one of your many.
Oh,
there you
okay.
go.
Right. Okay, so pressing right onto it, right where it attaches onto the scapula.
Okay.
Okay, and then also we can come down the arm and go on the inside of the upper arm right there. Where
Oh,
the
my.
triceps is.
Oh.
Can you find a painful
Oh,
spot?
yeah. Wow.
She found a painful spot.
Sure.
So we come down here and then we're going to go all the way to the tip of the elbow here. Okay, and then we're going to go on the. So let's try a couple different ways of treating this. We're going to do it on the inside of the upper arm too. Okay, let's see. So come like here and get. So this is one way of doing it. But remember, the triceps is a little hard to reach. So let's use that. Let's use your tiger ball, and get your balls. Let's come out this way.
Balls on the wall.
We're gonna do the balls on the wall. We're gonna do the balls on the ball. Okay. Okay, I've got a couple balls. You got your ball.
I got
you got your
one
ball.
here.
Okay, I got a ball for you if you don't have it. You got one. Okay, good. Okay, so we're gonna get. Remember that we're gonna do the triceps. You attach this here onto our elbow. So it's going to attach. So we want to treat this part of it and this part, and go all the way down to the elbow. So let's go ahead and get as much as we can reach here. So let's go ahead. We'll go up and down, and we're going to go side to side, and we're going to do little circles. So since my tennis ball slips around, I'm keeping my little fingers on.
Oh, I'm having in stereo. I've got two of them at once.
She's got stereo right there.
Oh.
We're coming all the way down
Slippery.
to the olecranon of the ulna.
Your ball is making marks on the wall.
Yes, what is your ball is shedding?
There's something on it.
Well, this is incredible.
It's shedding.
It's got some kind of goop
It's
on
got
it.
something on it, yeah.
We'll get rid of that
Get
one.
rid of
We'll
that
use-
ball.
We'll get rid of that one. We'll use another ball.
Weird.
Okay, so now
Toss
I'm gonna
that ball.
get turn a little bit backwards and get on the back part of it. Now another way to get it would be the tiger tail. Oh,
Whoop.
I got it.
Do you want to use this one?
Oh, this one feels like I'm getting an injection.
So
Like a
here,
shot.
I'm getting right on the back. So here you can get right on the back of your forearm.
Do you want me to get the tiger tail for you?
Oh, well, I'll get it.
Gonna get the tiger
I
tail.
won't have the camera person getting things.
Okay. We need more assistance. More assistance.
I'm gonna move the
It's going well with the tiger tail ball.
Oh yeah.
Good. She's bonding with that one.
Yeah. I like
It doesn't slip on the wall, is
Yeah.
it,
doesn't
right?
fall. No, you don't even have to hold on to it. It
And
doesn't.
you're having success with the ball and sock method as
Mm-hmm.
well.
Yeah.
Okay, so I'm going to use
Double
one of
duty.
these. Would you like to use one of these too?
Oh, I'd love to.
Okay.
All sorts of tiger tails.
Okay, here's a nice little one. This is a nice short one. This is kind of fun. So this one here, you get it right on the back. So there you can get the back much better.
Oh,
So-
yeah.
Oh yeah.
Yeah, that's nice. This would probably just be good for a lot of arm treating
Yeah, it's very good.
techniques on the wall, right?
Lots of it because you don't have to worry about it falling, and you can put a lot of weight into it. Don't you get? You can feel how
Could be good even
really. I can put tons of weight onto
for
it.
behind the scapula,
You're looking
right?
for yes.
Yeah.
So you can use it behind the scapula. Definitely, you could use it there.
Any kind of broad pressure.
Mm-hmm. Yep.
Ooh, it feels harder.
Deltoid.
Harder than
Yeah,
the
the
balls.
tennis ball and the sock
It's
method good
smaller.
too.
See, it's a smaller
It's
than
more
the ball.
specific.
So it's like
Yeah.
it's more like using this ball,
Yeah.
Yeah,
Okay.
less
but then that doesn't
Surface
fall.
area.
That doesn't fall down.
Yeah.
So this ball is probably about $1.50. You know, so this is a very good ball. It's the same size. This is the two of them would do similar things, but this one would fall down more rapidly. Yeah. Okay, so we're gonna do a good job on the other side. So let's go to the other side. So let's go ahead and feel.
Neil doesn't want to give
Yeah.
up her tiger ball for anything.
Ah!
She's sold on that.
Loves
She
it.
loves the tiger ball.
The tiger ball.
Great. So
Well,
we're
I
gonna
know
come
how to
down.
make a self-care product.
Yeah, she does a nice job.
Yeah.
She does really good with her products.
Who does?
Well,
Tiger tail.
the tiger tails.
Who is it?
Well, think of her name in a second.
Okay.
She makes these?
Yep, she does. She's very good. Okay, so you're going to press on it, and they're looking for those. You move it around, then you're looking for those painful spots. When you find the painful spot, you're going to like really press into it. And so you're trying to get on the back of the triceps there. Get into the back, and then come down all the way to the elbow. And the triceps is the most likely one to cause forearm pain, right here, forearm pain here, and causing elbow pain. Most likely one to cause elbow pain. So referred pain from the triceps. Also, the triceps can compress the radial nerve. So the radial nerve coming down across here like that. So that's another tingling and so forth. Okay, another thing you could use
Big
is this.
culprit.
You can get this from, a gumball machine or different places.
A
This is-
gumball machine.
Yeah.
Is it a
You don't?
gumball?
Do you want to chew those though?
Sometimes before a class, I go and get
For
20. I
TMJ.
take quarters, and I get a whole bunch of balls from the gumball machine. Yeah, that's
And when they're
good.
done, you have a snack, right?
Well, yeah, you can eat them though. Well, I try to buy the ones that you don't eat.
Oh, non-edible gumballs.
Yeah, so this is a good tool.
The tricep breaker.
That's it. That's it.
Oh
That's it.
yeah.
That's it. Okay, now we're gonna come down. Let's treat
got
our
this.
extensor
The tricep
carpi.
breaker.
Let's treat our extensor carpi all the way down to here. So we're gonna treat that all the way down. So we're gonna go ahead and put that right on the wall. So you're gonna go ahead, and you remember it starts
Yeah,
at
extensors.
our
Tricep breaker
extensors.
to the wall.
Yeah. Look it right onto it. Look for a painful spot. You're gonna come down. You're gonna press your body onto the tool, and the tool onto the wall. You're gonna look for a painful spot. When you find it, you're gonna hold it, breathe, and relax. Now, since we're gonna try to get the, we could bend so we could also bend that finger and stretch it a little bit while we're doing it.
Sure.
So we could go ahead, take the middle finger, bend it, and then you could also give it a little extra stretch. And then the taut bands on that middle extensor carpi will stick out.
The middle finger?
Mm-hmm.
Oh.
Because it attaches onto the metacarpal there. And keep coming down. So can you pin your middle finger, Tim? Right there. So we're pinning our middle finger. Good. And you're gonna put your weight on it. Come on down, further down, and keep coming down. And coming down. And you're coming down all the way to attaching right there on the middle metacarpal.
Oh, that's great.
You can feel it there?
Yeah, I mean, this is really a way to get at it.
See, so you can get at it.
Definitely.
And we know, we use our hands every day,
Yeah.
right? We know how important it is. So I'm just gonna pull out Protocol 54 again. I
Okay.
forgot to bring it over
Take
here
a
with
look.
me.
Let's take a look at
But, yeah.
Protocol 54.
One more time at Protocol 54.
You guys had some trouble. You had a little trouble with the extensors, right, Linda? With that
Yeah,
one.
I could do this, but I,
It's hard.
when
I
I, yeah.
have the same. We
Yeah.
both. We all have that
I
issue.
think we all have trouble with
Okay,
that.
so the ones that we want to do, one more that we want to do here is the Coracobrachialis right here. We're going to do that, and we're going to treat the Teres major right there. Okay, so we're going to treat these two. So here we're going to treat the Coracobrachialis. This is going to be great, you guys. Okay, so we're going to treat the Coracobrachialis. Now, one way to treat it is we could go like this.
Really?
And we can get right onto
Look
it,
at
right like
that.
that. And so that gets onto the attachment right here, onto the coracoid process there, on the scapula. So we'll get right
I'm
there.
gonna use my ball. I think that's gonna be too
Yeah, right
intense
there.
for me.
Yeah.
Then you could come a little bit like this, and then you're coming down into the arm all the way to here. So we're gonna come, so we're gonna start here, 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 and then there, okay? So sometimes I put,
Try that. Maybe it would a shorter tiger tail be helpful.
oh yeah, shorter's good.
Give him a shorter one.
Shorter's good. Yeah, shorter's good.
I think is that the? Oh, that is.
Okay, so we're gonna go like this. So sometimes I put a little, I put something soft on the end so that's more, it's not so pointed. But this is a good way. Another way is you could use the tennis balls like that. Yeah. So here,
Yeah, I can tell her this.
see, this is where it attaches right there. So right there, you want to put your body weight onto.
Oh
your
yeah,
arm.
I'm done. Whoop, see, then the
Okay,
balls.
yeah, the ball. Yeah, you get right there. Yeah. Okay, but to get the rest of it, you have to turn this way.
Oh, in,
Yeah,
on
that's
an angle?
it. That's it.
On
That's
an
it.
angle?
Yep, that's it. And then
Okay.
you're gonna have to go here, right there. Yep. Yep, right there. Yep. And then you're gonna go right here. Yep, right there. And then you're gonna go right here, right there. So what do you think? Are you getting it?
I think so.
What do you think, Linda? You
I
feeling
think I'm
it?
getting it. Yeah, yeah.
Mhm.
I think she got it on me.
Okay.
At it.
So you could put a little piece of fabric on here, several layers, and then it could be a nice tool for treating this way too.
Or maybe just
Yeah.
tie a washcloth with a
Yeah, I'm
rubber
in a
band
wash-
around it or something like that.
Totally, that's what I mean. That's it. You got it. She's
That's
got
the
it.
way.
A washcloth, fold it a couple times with a rubber band. That's a
That's
nice.
the way.
It gets a few different spots, and then the
Little
other part
broader
is
pressure.
we want to get the teres. Okay, so let's feel the teres right here. So this is the little teres major muscle. It's underneath here.
Oh, that little baby.
So it's right here. So it's going between the scapula and the arm here. So let's feel it right there. So let's all feel it between the scapula and the humerus right here. Can you find any painful spots on it? Anybody? Okay, so here, so it's between right there. So let's turn this way. So it's between there and here. So it's right here.
That's not too bad.
Mm-hmm.
There we go.
Okay.
Now you're talking.
Okay. Okay. So this is. Let's have the arm
This?
loaded. Yeah. So here, it's contraction. Okay. So that's what it does. It's contraction there. Okay. So that's how we're going to treat that spot. Okay. So we could use this tool.
Mm-hmm.
Okay. You want to try that?
Yeah.
This is working too.
Oh, you found a good way. She's found a good way. Okay. So here.
Nice.
So right there. And right here.
Yeah, that one I gotta push hard to feel it
Yeah.
relative to other areas.
Yeah.
There,
Okay.
that I feel
It's
better.
rather
Mhm,
small,
mhm,
I guess.
mhm.
Yeah.
And the other, we were using the tiger tail, and you're going to get a good job on that. So here, so you get in there.
It can be
Low.
exquisitely tender. This little muscle can be exquisitely
For me,
tender.
I wouldn't feel it like that. So I would do it this way. I get in there like that. Get in there really
She
good.
needs to feel more pain.
Well, like that. Yeah. into the scapula. So get into it really good, and then we're going to twist it, and twist it, and twist it, and twist it, twist it, and we're going to do for the forearm. Let's see how we're doing. So we'll see if we improved. So we want to get like this. We're going to get a right angle. Let's see. So for this, what you want to do is have your arm straight like that, so that the arm's at a right angle.
Oh, okay.
And then you're going to come like this, yeah. So here, so you're a little less than right angle. Or you do me, measure me, watch me, okay?
Beyond
Yeah. So
90 degrees.
Yeah. So you're looking to go.
Oh, so I've been
don't
cheating.
go like that.
I've been cheating with my arm up. I've been cheating with my arm up. I didn't.
Yeah, there you go. So there.
Okay.
Yeah. So yeah. So then it still needs more work. So let's think of. Let's go ahead.
What we've been doing.
Yes. Yes. Let's think of another good way to treat this. Let's all go into the treatment room. We'll find
Okay.
another good way. Okay.
Another good way.
Mm-hmm.
You're gonna have to take that pass away from me, Tim.
Uh-oh.
I had my arm up. I
Sorry,
had my arm up, so you're gonna have to take that pass
Oh.
away.
Cheating.
I didn't know I was.
Yeah, well, it's so easy to do. It's so easy.
Yeah.
Okay,
we
so
don't
one way we could treat this, so here, we were going here to the extensor carpi. So let's take a little picture, let's look at a little picture of our extensor carpi. Here it is.
Our little extensive
Excuse me. Okay, so here it is, okay? So we're gonna treat that, so so we can stretch it a little bit, so let's pin it, we're gonna pin it. And we could come like this, we're gonna go ahead and see it attaches here onto the humerus. And so you see when you're stretching it, now it sticks out, see? So here, so if you pin this finger, Tim, and then you go like this,
Middle finger.
little middle finger pinned, you can feel the middle finger fibers sticking out.
Oh yeah.
So I can feel them right there.
Definitely.
There's frequently a trigger point there in the middle finger.
Mm-hmm.
It's the running theme of this class, I think.
So how often do you have to do this?
Delayed laugh.
Okay, so what if this muscle was bothering you? If your
I didn't know it wasn't until I got
extensor
here.
carpi.
Yeah, I did work before we got
So
here.
like a lot of times I put it like at dinner time. I might be fixing my extensor carpi radialis. You know, I might be doing that. So I might get right on it. So I might pin it. I might be talking to Tim or to Linda, and I'd be just fixing my extensor carpi radialis.
While we're eating finger sandwiches and sipping tea.
So
I do say, rather, tea time.
Oh, baby.
I often fix my carpi at tea. It's fine time.
Oh.
Yeah,
Okay,
but
so-
pinning it, Leslie means, yeah, she's kind of pinning it with her.
So I'm just taking
with
this
her
finger and
thumb
holding it
there.
there. So you could now the extensor carpi, radialis, longus, and brevis stick out.
Yeah,
Right there. They can stick right out.
so it's on the stretch there.
Mm-hmm. And I'm just going to review the pain pattern with you.
Let's review.
Here's the pain pattern. So here it causes elbow pain, but also back of the forearm pain here. So the extensor brevis causes it more in the back of the hand, but the longus more throughout the forearm. So that's our extensor carpi, radialis, brevis, and longus. Yes, that's them. And how to capture them, how to find them, how to find those brevises. And it's
Make
your
them
longus
stick out.
and your brevis. Right on it. So like, okay, how frequently? Okay, so you said how frequently should you treat it if it's dysfunctional, right?
Yes.
Well, if it's not bothering you very much, maybe I might just treat it every day and just say, oh, is it getting a little better? And just make sure that I keep treating because I want to pass the range of motion test, and I don't want those taut bands here because I won't be as strong as I could be, right? But what if it was bothering me? I might treat it 20 times a day until it's gone because I don't want to feel that. And a lot of times, you guys might see me because I've been using, how long have I been in this field now since 1983, and I passed these range of motion tests, right? Just because I said, but if you're sitting here talking to me sometimes at lunch, you'll see I'll put my hand like this. I'll find the taut band, and I'll be just putting my hand like that. So, so I
Constant vigilance.
I can't tolerate my hands
Yeah.
not working.
Yeah.
I mean, I feel it's a feeling like I gotta have my hands.
Yeah.
Okay, so if something's not working, I'm right after it, and so I might spend a day or two just.
Well, now I'm finding it on this side. So.
A little bit so you've got the other extensors. So
all of them probably need the work.
Very likely we'll be doing those soon, and you could get them done before the next class.
Your homework assignment.
Had an interesting question. Someone was asking if cracking knuckles would release some of the finger attachments.
It doesn't fix it ever, but it's an indicator that you have tension, and it does release it. So when you crack them, it's releasing the tension. But I like to think of it as, if I could, I treat all the muscles and get it so that I don't want to crack. You could. If you get everything to release, most likely you won't want to crack anymore because you won't feel the tension anymore.
Interesting.
Yeah. So sometimes I go like this and just stretch just the wrist extensors, and sometimes I go like this and do the finger extensors as well. So I get
That's the hard one.
I get the finger extensors, and I just rest it like this. I just rest it, just stretching it, because when we're treating people, we're using those extensors all the time. Those are all the time we're using it. When we're typing, we're using them. So there's lots of reasons to use them, but particularly as therapists, I'm using these a lot. So I want
A lot of musicians probably have trouble with that one.
Musicians, you have to have this muscles working.
Yeah.
You gotta have them working. Okay, you just have to. All right. Okay, so we did 52 and we did 54. Isn't that great? We did them. So
Next on the agenda.
Okay, we're gonna do. We got something really good on the agenda here. Here's 50. Here's
Do you
54.
recommend ice or heat after doing a treatment like this?
Well, why would you use ice?
For inflammation.
We don't have inflammation.
Okay. Don't use it.
Yeah, so I would use heat because we're trying to get the muscles to expand. Heat makes it
To
expand.
relax. Yeah.
But ice could have its good points, but for the most part, we're trying to get the attachments to get soft. Heat makes it better. Everything heat usually makes it. But
would you heat it up before treatment?
Yes.
Use like a hot pan or something?
Yes, we've done it so many times, haven't we? Done it a lot
Oh
of times?
yeah. That's right.
We've
With the
done it
neck.
a whole bunch. We did it a whole bunch of times. So we very frequently, especially if something's really painful, let's take a shower or bath first, okay? But there's other ways we could make it, so we could treat it lightly first too. So we could do a lot of different techniques. So what if this was so painful you could hardly treat it? We have some great techniques to correct that. So I that's why I had these.
Oh, we haven't used them.
I have a client that likes to use ice, and it makes her feel better, but I don't really know if it's the right thing to do.
Well, you could check this. See if she's getting better? Is she passing her range of motion test? Now, some people who use too much ice, their tissue contracted and they could never pass the range of motion test.
Because it would relieve it, because it might be numbing.
Well, you just check it. You can see if you're getting better. See if it's working. See if it's working. Okay, so here we're going to use this Myo Buddy here. So we're going to so this would be good if you have a real sore area, and you want to get it to be a little less sore. You could use the Myo Buddy. You could, and then we could then follow it with treating deeper with the tools. So we're going to.
I was waiting for the body buffer to come out. I was curious what we're going to do with it.
Bit of a buffer.
Okay, here we go. Okay, here we go.
My water.
Oh, okay, so
And the water comes in.
Tim, could you take this one?
Yeah.
Could you take this one here? Okay, and Linda, could you take that one? Okay, so we're going to turn it on. Okay, so here, this is the turn on.
Whoa.
So that's.
Getting buff.
Have some fun with this.
Okay, so here you can see that. So we could go. We could do is we could. What if? So let's press it again and go to about medium.
Whoa.
Okay. Okay. So one of those.
Two medium.
Yours is a little different than this. You could go a little higher than lower. Okay, so you can treat this while you're stretching, like that. Like this. And look at Tim, you could use the edge of it like this. The edge, like that. Can you get it right over the wrist here?
Will that help here?
Yeah. Especially working here would help.
What's the advantage of this tool?
Okay, suppose what you'd like to treat. Shut up for a second. Okay, so you'd like to treat this part of your arm, you know, right here. Oh, it's so painful. Or I want to treat over here. It's so painful. You don't want to treat it. Or over here, I can't stand that. It's so painful. Okay, so you could do this first.
Any area where it is so painful.
But what I'd like to do is put it on the stretch. So then I would put this part here on the stretch. So I put this, stretch it. And then I get right on the sore spot right there. And we're dissipating some of the painful chemicals. And we're treating it a little bit before. And this gives it a little warm up. Okay, so let's take a look at you.
So you've used that when people are a little too sensitive for more localized.
And it warms it up really good. So you can go like this.
So it's basically just increasing the circulation.
That's right. That's right. See?
Yeah.
Oh, we're passing the range of motion test. Woo! See? So I'm stretching it. I'm stretching it, and she's passing now.
Right.
So I'm right on the trigger point there on the extensor carpi.
This is nice too if you are unable to treat yourself for some reason because you don't have a lot of, you can't apply a lot of effort. This might be handy for you.
So let's do her triceps. So here we're gonna treat it. So we put a little bit on the stretch, and then we're gonna treat it, and we're gonna get behind your ear. Here it goes. So here I'm going to go right to where it attaches onto the scapula. And it also goes up a little higher.
Making a cringy face.
Oh, that's too much.
That's too much for that. Let's go over.
Right there.
If this is good.
Maybe on the arm was good.
1, 2.
1, 2. Okay, cool.
Two's good.
Yeah, triceps are a little tender.
Okay, let's go ahead and let's look at her infraspinatus. So go ahead and reach to your opposite shoulder blade. Okay, so let's go ahead. We're going to treat your infraspinatus on the side. And then you can see if you can get the shoulder up a little high. Well, if you can, a little bit. Yeah, so just as you're treating it.
Watch out for your hair there.
Did somebody warn us?
Me, yeah.
So here, you can treat it while you're stretching. So you want to go ahead and you try it? Give me this hand. So you can get right on it like that. That's your supraspinatus.
Yeah.
Can you hold on to it like that? Okay, and then let go. Okay, so let's do the Coracobrachialis in the front. Okay.
Oh, yeah, that's it.
Okay, so go ahead. Remember where it was? Like right here, and then goes over right here. And right here. Let's go and try it. Yep, go ahead. So it goes right here. And try to get your subclavius.
Oh, yeah.
Try your subclavius. Get under your collarbone there. I love this thing. She loves this thing.
It's a riot.
One's a skeptic. No.
Okay, suppose you wanted to touch your toes. Okay, so go ahead and turn so you can get your back. So go ahead and touch towards. Okay, go as far as you can. Then you can go ahead and come here. Look for where it's tight, and see if you can touch your toes there.
I think I have to over the over.
See what's stopping you from touching your toes.
I think it's hamstring.
And we can go there. Okay. Then see if that makes it better. Okay, so go ahead and try it on your hamstring. You try it.
Oh, I know. Really easy.
Yeah, so you get these at massagewarehouse.com?
I don't think they sell them there. I think you get it.
Amazon?
No, I don't think they sell them there. Yeah, there it is.
Myobuddy.com.
Yeah, the product is from MyoBuddy and myobuddy.com. You can get it there. Yeah. Someone was also asking where they can get a hold of the ultrasound machine.
Okay, so you can call Mettler Electronics, MELTER Electronics, and they'll sell
Melter?
Mettler. It's probably it's right on there. Yeah.
Let's see. Yeah, Mettler. METTLER Electronics. Yep. Yeah. Yeah, so that's the ultrasound machine which we used last week, which has a relatively similar use. You use it when people are a little bit too sensitive for intense localized pressure.
But this is something you can do every day at home. You know?
Yeah.
So you can treat your chest.
Yeah, this is a little bit more, realistic for most people.
Yeah, so this you get your QL. You can treat all over your body with this. It's nice tool.
And then someone with fibromyalgia should tolerate this,
Yeah.
where they would not be able to tolerate.
This is what I found. Some people with fibromyalgia, okay, they might like it, but it's very stimulating. Okay?
Yeah, so it depends.
It could be too stimulating at first. But if you start it really low.
Well, I've been using 2, and I think I have an older model here.
Yeah, but if you start low, you might work it with it. It might work for them. Because it's working superficially. So what you're trying to do with people with fibromyalgia is desensitize them. So you might take 2 months of working with a very light, maybe much lighter than this, and after a couple months you might be able to get in and use a tool like this. Yeah.
Yeah. Someone was also asking where you get your electric table.
Oh man! Sean Gardner got this for me. Sean Gardner from Minnesota. He's a myofascial trigger point therapist. You can find him probably on the national registry. But I like the tables from Oakworks. Oakworks.
Do they make the electronic tables?
Yeah, they do.
High-low
This one's
table?
nice. This one's nice.
Yeah, there's a number of companies that
This is
make them.
Touch America.
Touch America is the brand on this one.
Yeah.
The one I have is called Stacy Built, and he's in the South somewhere. I forgot. He hasn't come to a convention in years.
Nice.
There's a number of people that sell them.
High-low tables, yeah.
We love them. We love them. And you, how many years did you wait before you get a high-low table?
0.
Yes, that's it. Now I have found some terrific tables for $200 and $400 used on some of the different places you can
I
find.
have a non-electric oak work table in mint condition for sale.
Oh, you haven't for sale?
Oh, okay.
Would you be willing to make a list of all of the products and where they come from?
I have a nice. I'll do that for you.
Oh yeah, we should do
I'll
that.
do
Yeah.
that for you.
And I think other people would appreciate it too, because
They
we're
would.
kind of getting
Yeah, we could do that.
one product at a time during a session, and I missed the ultrasound last week.
Yeah, we can try to include that in some notes, and maybe when we post these videos on YouTube, we could include them there, so that they'd always be referenced with
Yeah, that would be great.
Ones that
And
we do.
where those what do you call them?
or we could
The knobbers come
maybe
from.
make we have basically all the same tools that we use, so we could do that. A nice list
just
on
a
the
list
website.
of all the tools and things and where they come from.
Stay tuned for the product list.
Okay, so let's think about what is an underlying perpetuating factor in forearm pain. Okay,
Yeah.
so let's take a look at you for a second.
Okay, well the head forward
That's
thing.
right. Okay, good. What else?
It's got a life of its own.
Choking. It's choking.
I think it's an older model. Didn't like it.
It
Okay.
is an older model.
What was the question?
Well, so am I, but
How did I know that joke was coming? How did I know?
how did you know?
Someone
know?
was gonna make the
Okay,
joke.
so perpetuating factors would
Yeah.
be the head forward, holding the
Right.
head forward.
Head forward. How about breathing in such a way,
Oh yeah,
That
just
you're-
upper chest breathing
Right.
without doing any abdominal breathing and overworking.
overworking it, right? Okay, so those are two major ones, but how about another one? First metatarsal deficit. How would that cause forearm pain?
Morton's toe.
What do you think? Yes,
Well,
Morton's
because
toe.
of
Morton's toe.
alignment. Because of
Correct,
alignment.
because
I have
okay.
Morton's toe.
So if your one shoulder is higher than the other, Tim, what happens is that shoulder is the one that ends up having the forearm pain. So if you have any reason from your posture that you get one shoulder higher than the other, one way of correcting your ongoing problem in the future would be to get that shoulder down. So what are some ways that we can correct that? So, so first metatarsal deficit. So frequently what happens is when you have a first metatarsal deficit, one shoulder is higher than the other, and one hip, this hip is higher and that shoulder is lower. So one shoulder's lower. So we can take a look at you without your shoes.
Yeah, without my shoes.
So is it on the side where she has the Morton toe, or the opposite side?
Well, they
Does
both-
it cross over?
You have two Morton toes.
You always have two Mortons.
Oh, yeah, you can't have just one.
Issued, standard issue.
If you have 2 feet, you have 2 Morton toes.
Yeah, that's the more inclusive.
So then why would just one shoulder be out of alignment?
Excellent point. Excellent point. Okay.
Aha.
Okay. Okay. See how this one's shorter and this one's higher. Okay. So this one's lower down.
Mhm.
So I'm right on the. So you have to feel the spine of the scapula, and you could see if I had a wooden thing, you could see how it's.
Or if you had a tape measure, you could do it with
Yes,
a tape
I could
measure.
Well, no, you need something
Here,
straight.
this is it.
She needs a
So-
plane.
So here,
Yeah,
a carpenter's
here,
plane.
see, like that. See? So this one's higher and this one's lower, about a half inch. Okay. Okay. So when we correct the first metatarsal, then we find that it corrects. So let's go ahead and correct
Well, I
it.
have my
The shoulder.
things in my.
Oh, okay. Let's look at that. Let's do that. So we're gonna just use her shoe inserts here.
Use
Okay.
my shoe inserts.
We're just gonna use those.
Use the ones I already
We
have.
just use those right there. Okay. Then
Okay, well, let me turn this way.
that's great. She's gonna turn. Okay.
Mm.
So now
So
she's
now-
gonna step on them. And
So
now-
inserts.
Her shoulders are even, okay? So step off. Now the shoulder is lower. But not only is that shoulder lower,
This hip
the
is
hip
high.
is higher. So you can't put a heel lift in because it would just make the hip higher, okay? So what's happening with this is sort of like, go ahead, step onto it again. Like we're right next door to the John Hancock building, okay? And you know, the John Hancock building is known for those beams that go like this.
Crisscross, yeah.
The
Crisscross.
fascia is like that. So when you have the first metatarsal deficit, somehow the fascia does it causes you to be uneven, and that's what's causing a combination. It's not the bone difference. It's more like a fascial difference. So now we corrected her, and so now she won't be likely to have dysfunction in the higher shoulder, the higher forearm. So
that answers.
because-
Someone just asked the question: would you ever put more of one lift in one
No.
shoe than the other? Yeah. So
Okay.
you would not.
I would not, but doesn't mean not written in stone. I might just try it, but generally it's not what works. But you could always try stuff. You can feel the person after you put the lift in, and you can see, is it helping? And then if it's not pressing on the scalene or the scalene minimus, then you're not going to have the dysfunction here, or so.
Sure.
So definitely there's many things to look at, but head forward position. How about sitting in such a way that it causes you to have your head forward? So remember we talked about this a couple times, but if you're higher up, Tim, like this, you're less likely, and then your chest goes more like this. But the lower you are, the more you're like in a bucket seat, the more you go like
Oh,
this. Okay?
Oh.
It's a hunch over.
So this is the tendency for if you're the lower you are, like the lower bucket seat. So what you want to do is get yourself into the higher position. Not so high as me for you, but
Right.
but where you can feel your back getting into a little bit of lordosis. And not like this. Like you can't almost do kyphosis when it gets higher up. Okay, so okay, so
we have to wrap up. We do have
We're
one
wrapping
final
up.
question.
Okay, go ahead.
Did you want to make a point? at the
oh
end?
no, I'm all done with points.
Okay. Someone was curious about how you help someone with lymphedema in the pec area. That client had lymph nodes removed.
Wow, I've had such good success with working with that. I would find all the myofascial dysfunction and treat it, and when you do that, you get rid of it. It works so great. It's like
Yeah.
I've had so many women
feel
with reconstruction.
strangled.
Yep, you can definitely do it. So I just want to review what we did today. We did the 52 and 54. Next time we're going to do February 14th, Valentine's Day, and you're going to bring your Valentine to the class, if you'd like, and we're going to do.
That's going to be the finishing up of the arm or the wrist and forearm, right?
Right.
Yeah.
Right.
Elbow pain relief.
So this
program.
one here is
So
protocol
we'll do
14, Volar Forearm Pain 53, and Volar Wrist Pain 57.
Palmar pain.
And Palmar pain, sorry, Volar wrist. So that's what we're going to do next time. So print those out.
So that's what's next time. Yeah. And then if you want to get 2 CEUs for this, just email us with your Periscope handle, your name, your license number, and the name of the class that you watched. Then we'll double check that you did watch it, and we'll send you some credits. Are we ready?
Yes.
For
Do you want to announce our
Pardon
song?
shots?
Okay,
Yeah.
this is Sharon's Pain-Free song by Camille, revised, copyright 2017, something like that. Oh, wrong one. Something like that.
No bootleg.
No bootlegging.
Free streaming.
Okay, you're to this right shoulder.
Sharon and Mareva from Pain-Free.
Chin to the chest.
Who want you to remain free.
Rotate.
We will assess and use heat,
Hands to the shoulder
then
blade.
compress
Hands to the shoulder blade.
and repeat. We'll balance your posture from your feet and effectively treat on the stretch and on contraction, restoring full function to every action. Come to water tower to meet Sharon Sauer. Use the body support system for side lying position and hydraulic lift table. If you are not able to jump when a trigger